terms of what we know. So public info from government side has not really flowed a lot today.
Good afternoon, Donnie. Good afternoon to our viewers. I'm glad you're still standing strong and that we're not yet suffering from COVID-19 fatigue. The presidential spokesperson, Donnie, Dr. Alfredo Hengari, at about 27 minutes to 2, issued the following very brief statement. He says the Ministry of Education will communicate imminently regarding the education sector. Consultations with stakeholders are still ongoing. He also says that the Interministerial Technical Committee is meeting today, that is the 15th of March 2020, to decide on measures and also especially to give effect to the measures already announced by President Kengop. Dr. Hengari says, as you can imagine, these measures have very serious implications on our way of life and do require adaptation on the part of all affected parties. He says the presidency pleads for vigilance, a high sense of responsibility and cooperation on the part of all stakeholders. Every effort is being made to ensure that the virus does not spread in our communities. The health of Namibians remains the first priority of President Kengop.
Yes, apologies also for us just being a tiny bit late. We wanted to go live at 1, that wasn't possible, but we hope you are tuned in. Ethiopia also made special arrangements yesterday to get people back to the country.
Yes, what we do know is that part of the measures announced by the presidency yesterday included a ban on flights to and from Ethiopia, also to and from Germany and Qatar. But we understand that Ethiopian Airlines did land at Hosea Kutako International Airport this morning. There were a number of Namibians in their capital, Addis Ababa, and that flight also returned to Ethiopia. I think that is something that will need to be looked at, whether it will also affect other airlines flying in those routes that have been banned for the next 30 days, Dani.
Yes, in terms of the airline business, a lot of chaos at the moment with people visiting Namibia who have to reschedule flights because they now have to travel via South Africa back home, for example. We'll be bringing you an update on that in our show late afternoon today. But yes, a public health specialist was scheduled to speak to us, but he was called away Denver for very urgent business, but he did send us a message.
Absolutely. His name is Dr. Ahmed Azadeh. He worked in the East, in Asia in particular, when they experienced outbreaks. So he's also got that background. And because he couldn't make it to us in person, he shared the following clip with us. So let's listen.
Hi, I'm Dr. Ahmed Azadeh. I'm a GP and an emergency room doctor, as well as a public health specialist. So, having previously worked in Asia during the swine and avian flu outbreaks, I wanted to speak to you all a little bit about the coronavirus COVID-19, which was confirmed in Namibia yesterday. So there's a lot of information and misinformation out there. So my hope really is to inform you of the situation so you're aware, to address some of your concerns, so we can remain calm. So a pandemic, which was declared by the WHO, means the infection is no longer contained and also is having ongoing person-to-person transmission in many places across the globe, as opposed to only imported cases. As we know, in Namibia, we've had a couple of imported cases that were announced yesterday. So there is no evidence of person-to-person transmission at this stage, but we are in the pandemic stage. The Ministry of Health is tracing all contacts of those imported cases, and right now, we don't have any evidence of person-to-person infection. But the strategy during the pandemic anyway changes from containment to slowing down the infectious rate. We do this so we have a chance to treat those who do fall ill. Now, there's 3 key messages I'd like to bring across. Number 1, the COVID infection symptoms are similar to the annual flu we do see every year. Most of us will get mild symptoms, and it seems that children do very well, but those with specifically lung and heart disease do need extra care. This is not going to be a severe illness for the majority of us, so keeping calm and following instructions such as those given by the Ministry of Health are important, so that infection rates can be lessened and those who do become ill can be treated effectively. Number 2, if you do fall ill with flu-like symptoms, it's best to stay at home and self-isolate yourself, as you would do with the flu anyway. You only need to go to a doctor or an emergency room if you start to have a worsening cough and fevers, high fevers, body aches. If you go too early, you place yourself and others at the risk of catching other diseases. You may go there thinking you have COVID-19, where you don't, and you may then expose yourself to others who have COVID-19. And then number 3, keep your immune system strong, mainly by resting well, washing your hands regularly, and most effectively by something we call social distancing, which means you keep a meter apart from everyone else when you go about your day. I hope this helps, and stay healthy.
Denver, yes, indeed a specialist. What is one takeout you would emphasize from his message?
2 takes, please, Donnie, if you would allow me. Firstly, that this is not going to be a severe illness for the majority of us. That speaks to the message that we should avoid panic. And he says, do not go to an emergency ward unnecessarily. You might go there without COVID-19 and then in the end expose yourself to the virus and contract it. So do not rush to ER unnecessarily.
It's not unique to Namibia because we've seen it all over the world. And since yesterday morning when the first 2 cases in Namibia were confirmed, we've seen it locally as well. We've seen people going to the shops, going to pharmacies, they're standing in line, there are queues. We see people with gloves, we see people with all kinds of masks. Some of it is not even effective or the right kind of masks, Denver. And especially, I mean, the message by the WHO as well is, don't panic. You don't necessarily are going to get sick. The sick people need what is in the market much more than you do, most
Absolutely,
probably.
because the impression that I get, Donnie, if I go to a shop and I see someone wearing a mask, I'm very scared that that person has the virus, while that might or might not be the case at all.
Although we must say also we do understand the realities, we know humanity, but we are also trying to do our best to inform you in the best way possible. Now, which products, we are going to look at them shortly, COVID-19 and retail, and which products are really being sought after. Now, first of all, let me point out, Denver, one is not there. Maybe our designer was just being polite, but not putting a toilet roll there. But shown in red, hand sanitizer. In many places, it seems not available anymore, out of stock. There's a proper surgical mask, but remember, you don't need it if you have not been tested positive. Tissues and sanitized tissues, soap, and then also vitamins. That is what people seemingly are scrambling now for, Denver, when they go to the shops.
And you know, someone has expressed concern on social media. What about those members of society who live in informal settlements, you know, who are struggling because of poverty, who don't have the means to purchase these items? So what are we doing to take care of ourselves and our loved ones? But are we also taking care of those who might work in our homes, who might work in our offices? So although we shouldn't panic when we do take precautionary measures, let's bear our neighbors in mind too who might be struggling.
The following material we are going to show you now was taken this morning in Walvis Bay, and I want to, before we show it again, repeat to people, unfortunately we cannot control people's behavior, so they do things that make them feel safe in terms of putting on masks, etc. This is some footage from the situation in Walvis Bay as it was this morning.
Stay tuned.
Ons is by Rianda van Dunesmol Apteek. Goeiemôre Rianda.
Môre, hoe gaan dit?
Dit gaan goed onder omstandighede.
Ja.
Sê vir my, vertel vir my van julle maskers en julle hand sanitizer.
Maar die maskers en hand sanitizers is allemaal uit, maar ek het vir my mense, omdat hulle met baie kliënte werk, het ek my maskers en handskoene gegee vir die wat wil gebruik. Ek voel egter in die apteek moet my personeel dit dra, net om dat ons met siek mense werk en siek pasiënte werk, maar die feit is, dit help nie van 'n massa hysterie te gaan nie. Ons moet nou maar net positief bly en ons moet my saak ook maar vir die Here gee, weet en vas staan. En ek dink dat ons moet mekaar beskerm, maar skoon lewe. Maar ek dink ook as jy weet van iemand wat die virus het net jy moet vir die ander vertel of jy moet dit rapporteer, jy weet dat mense kan beperk.
Ja, sê vir my, watter ander advies het jy nou vir mense wat nou nie gaan maskers kry en hand sanitizers en dinge
Maar
so doen?
weet jy, daar's niks so goed soos 'n serf wat hulle kan omgooi as hulle voel hulle wil iets gebruik nie. En ek dink op die ou einde, hulle sê die Dettol en die Savlon en daai goed gaan nie werk nie, maar ons kry aan die einde van die week kry ons weer sanitizers in. Ek weet nie van die maskers nie, maar ons kry klomp stok weer in en ons gaan almal probeer help daarmee.
So, baie dankie.
Doodreg.
Otis Fink, he is heading Irongo, our online publication at the coast. Good morning, Otis.
Good day, Danny, and good day to all our viewers.
Otis, we've just shown some footage now to viewers of the situation in Walvis Bay. You spoke to a pharmacist or an assistant at the pharmacy. How would you describe the situation in general?
Danny, I would say very, the mood is a lot of misinformation around. That's creating a lot of scare. And then, I think generally speaking, people do not know what to expect.
Denver, any questions from your side to Otis?
Otis, is it your sense that people are concerned because of the misinformation, or are they generally concerned?
Generally concerned. And I mean, by now we all know that the passenger vessel Ida Amira called at the port of Walvis Bay and Udrats earlier in the week, and the passengers were allowed to disembark. But Namport and the Ministry of Health gave the assurance that these passengers were tested and that no coronavirus cases were detected. So it is now known that the Cunard and the Hollard America passenger lines have suspended their services. So another 10 vessels were due to visit the coast or to visit Udrats or Walvis Bay in this upcoming period. We also know now that Ida Mira, Astor, MS Insignia, MS Orchestra, Seven Seas, Mariner, these vessels will no longer visit or they will no away. So the Queen Mary 2, Silver Whisper, Amsterdam visits will possibly also be cancelled. And this brings huge implications for Namport and the tourism industry as such. Also, Wiltshire Hospital refuted claims on social media that started circulating on social media that 2 persons were taken up there with the coronavirus at the hospital. The hospital said it's not so. And then the Sanlam Marathon scheduled for 21st of March was cancelled here at the coast in Walvis Bay due to the health scare. Then also we know that the Desert Sport Festival possibly also be cancelled, and 6 South African schools was expected to come and participate here in Walvis Bay. And then we're also waiting for feedback from the organizers of NAPSO because there were another sport festival scheduled for Swakopmund, I think starting tomorrow and so on. Yeah, so Dolphin Schools Director Carmen Meyer, however, announced that the school will be closed until 29 March as a precautionary measure. And then I visited the Catholic Church this morning, and I noticed that the water used that people used to dip their fingers to make the sign of the cross were removed, and the practice of extending peace, greeting, were also suspended. That's now for the Catholic Church. And then I made the rounds at various shops. I observed that they handed the workers plastic gloves, and then one shop even availed hand sanitizing spray and wipes at its entrance so that customers can wipe their hands and clean their hands and so on. Yeah, and then when I entered the chemist, I noticed that all the staff there were wearing masks. This lady told me that all the masks and sanitizing products were sold out. But she mentioned something interesting. She said, do not panic. You can even use your scarf. Wrap your scarf around your mouth. Because we know now that quarantine is one of the best mechanisms to curb the spread of this virus.
Thank you very much, Otis.
Yes, and then
Otis, sorry to interrupt you. Thank you very much for quite a substantial summary of news there from the coast. That was Otis Fink in charge of Irongo, our page. They're dealing with news from the coast. Feel free also to watch what they are sharing throughout this time. East Denver, just to come back that, and we've already spoken about tourism yesterday. So yes, if you think in terms of those tourists just coming in at Walvis Bay from a visit from a ship, and all of that also will have a huge impact.
Yeah, and ultimately what poses a logistical challenge is to trace people. You know, if we have suspected cases, how to get hold of these people to make sure that they are tested. And I think the same applies to the couple who has tested positive for the virus, to trace the number of people they've been in contact with and to establish their health condition. That poses quite a serious challenge.
Up next, footage taken in Swakopmund. That was also earlier this morning.
I feel so bad now to have a coronavirus in Namibia because like our kids, we cannot even give them to prevent themselves because kids don't know what is going on, and maybe we can just depend on God. Nothing we can do about that things.
Yeah, just the advice the people to use to protect themselves, wearing mask and hand gloves to protect themselves.
Why?
Because this one is a serious disease. We don't know where it has come from.
Okay. Just hang on. Finally being here in Namibia.
Well, it's like I said, I don't like it, but you can't do anything. You have to wait and see what's happening next.
We have to wait for the cure.
Yeah, we're all waiting for a cure.
It's not going to come from here. It's going to come from America.
I don't know.
Or Germany or somewhere like that. Where they're working on a cure for the coronavirus. All you can do is pray and hope you don't get it.
Pray.
All right.
And don't interact with the Chinese.
Okay. Thank you.
You're welcome.
This is serious business. Those were the two exact words she used, Denver. And indeed, all of us know it's very serious business, but yet we must also try to follow the proper instructions. So please share the information we share on our pages with as much people as you can.
Indeed, Dani. Mr. Harold Akwenye, the spokesperson for City of Windhoek, announced that they are also spreading the message and emanating the call from government for people to protect themselves. So although no measures or plans are in place to close businesses like Shabin's yet, it's important for people to realize that their contribution to curbing the spread of the virus is important and will make a difference. So please prioritize the health of yourself and your loved ones, if of no one else, to make sure that the virus doesn't spread and that we contain it and that we can curb it ultimately.
During our first update yesterday afternoon, that was actually emphasized by various medical practitioners or people in the medical field, is also consider where you are going, where you are visiting in terms of public events, for example. But I'm sure later today and tomorrow, Denver, we still will get information. We are expecting, as we've said, you've said, an announcement from education as far as schools go. Schools, of course, were supposed to start tomorrow as usual. Another clip then quickly for you. This is a Namibian student studying in the USA. His name is Ben van der Walt. Let's listen to his message.
Hallo allemaal, my naam is Ben van der Walt en ek is 'n tweede jaar by New York University in New York City en ek wil vandag vir julle 'n bietjie vertel wat ek hierso sien en hoe die mense in die stad optree met betrekking tot coronavirus of COVID-19. So eerstens, NYU het nou al hulle in-persoon klasse gekanselleer tot 19 April en moontlik vir die res van die semester ook wat so tot 17 Mei is. Ons het nou 'n stelsel wat hulle noem remote instruction en hoe dit werk is, dis baie so Skype. Jy gebruik 'n program op jou rekenaar en dan konnekteer die hele klas daarop. En dan dit is nou hoe ons gaan beplan om die res van die semester te doen. Jy kan 'n video van jou professor sien en van al die ander mense in jou klas en dan kan julle so met mekaar praat. So dit is nou wat die universiteit se plan is om die res van die semester uit te voer. Verder het baie van die universiteitsgeboue begin toemaak. Daar's 1 of 2 koshuis eetplekke wat nog oop is, maar baie van hulle is ook toe. So die universiteit is op hierdie oomblik regtig besig om te probeer om die hoeveelheid fisiese kontak wat mense met mekaar het in groot groepe te verminder. Meeste van die sosiale vergaderings is ook gekanselleer vir die res van die semester. So meestal wil hulle hê jy moet of in jou flat of in jou koshuiskamer bly en nie te veel uitgaan nie, maar as jy wil kan jy natuurlik. En as mens dan uitgaan op die strate, dan sien jy 'n paar goed wat nou anders is as wat dit van tevore was. Eerstens, mens sien baie meer mense wat die gesigmaskers aan het en ander sosiale goed soos mens groet nou nie meer noodwendig met die hand nie of jy gee nie 'n drukkie vir iemand noodwendig nie. Wat mens nou meer doen is jy verminder daai fisiese kontak. Verder mense probeer om die deure met hulle elmboog of met hulle voet oop te maak. En as jy binne 'n gebou is daar gewoonlik 'n plek waar jy jou hande kan was met hand sanitizers. So oor die algemeen is baie mense meer bewus. Daar's 'n ampere sosiale verandering in hoe mens dag tot dag met mense 'n interaksie het. In terme van New York City en New York State as 'n geheel is ons nie heeltemal seker hoe hulle vorentoe gaan daarmee nie. Daar was onlangs sprake van 'n lockdown wat sou beteken dat niemand in of uit die staat mag gaan nie, maar dit was net sprake. Ek dink dis op hierdie oomblik nogal belangrik om nie noodwendig alles te glo wat mense op sosiale media sien nie. Maar Donald Trump het ook onlangs 'n nasionale noodtoestand verklaar. So mense raak effens paniekerig. Daar's baie mense in winkels, lang rye van mense wat kos en proviant probeer koop vir die volgende paar weke vir ingeval hulle binnekant moet bly. So daar is definitief nogal 'n hoeveelheid ongemaklikheid en onsekerheid onder mense hierso, maar New York City is nog steeds New York City. Dinge gaan relatief normaal aan. Daar's nog steeds mense op die straat, dis nie heeltemal leeg nie. Mense gaan oor die algemeen werk toe nog, maar universiteitsgewys is dinge redelik toe. Hulle probeer dat jy meestal in jou koshuiskamer moet bly. Ander ding wat ek voel meer en meer mense hier agterkom is dat dit nie net 'n 3 dae lang ding is nie. Dit kan weke wees, dit kan maande vat. So ek dink op hierdie oomblik is dit belangrik om die groot prentjie te sien. Ek dink ook dis belangrik om maar net na jouself te kyk, higiënies te wees. As jy in 'n stad is waar daar gevalle daarvan is, om seker te maak as jy moet uitgaan, dat jy veilig is, maar dat jy oor die algemeen so min as moontlik uitgaan. En die feite op sosiale media moet mens maar net double check ook. En ja, as New York State nie onder lockdown gaan nie, dan sal ek hopelik binnekort kan huis toe kom. Meeste van my kamermaats en klasmaats is al terug na hulle huise toe, so sal lekker wees om terug te kom na Namibië toe waar dit veilig is hopelik. En ja, dankie dat julle geluister het. Lekker dag.
That was the voice and picture in video of a Namibian student studying in the USA, Ben van der Walt. He spoke Afrikaans, but to shortly summarize, the university where he's studying, they have cancelled classes up to the 19th of April, and they may lengthen it to the 17th of May. They are basically using remote instruction. A lot of restaurants for students has been closed, so the way they go about it is to minimize contact in groups of people as far as possible. Denver.
I think it's a call that we need to heed. I find it fascinating that despite these global calls for people to self-isolate, that you still find people on the streets. If you don't need to be out on the streets, if you're not making a meaningful contribution to fighting the virus or to helping sustain your economy, it's best for you to remain indoors.
Denver, thank you very much for your contribution again today. We also want to just apologize. 2 little video shots of our airport did sneak into the video earlier. That's something we're going to talk about later this afternoon. And again, once again, we'd like to say goodbye with a message: stay safe.
Thank you, Donnie, and thank you to our viewers. Please share this broadcast and interact with us.